We have a range of domains for ADHD as a label. If you read DSM, it's hyperactivity, impulsivity, inattention, and combined, correct? But what we've gone through is we're going to look at symptoms differently. Sometimes it's really even helpful sitting down with the patient and saying, I want to focus on these. When I show you the hierarchy, you can sit down and then say, I'm going to rule out each one. This is one of the things I do, and I'll show you later. Really help with diagnosis. So you can sit down and ask them to give you an understanding of what their cognition was like, and you can tell them what that means. So conceptualization of ADHD domains, this is what I'm thinking. What's their cognition like? Predominantly frontal lobe, executive function. The next bit is activity, right? Motivation, drive, remember anticipation, remember that entire thing. Anticipation, how do they make decisions? Do they get up in the morning? Are they able to go? Are they engaging in tasks? And it's got to last sufficiently towards the end of the day as well. Then I'm looking for reward sensitivity. Here I'm looking for the responses to reward. One is anhedonia. Do they experience pleasure? Do they feel the get up and go in the morning? And the other bits are they compensating by using maladaptive strategies to increase that reward, to improve reward sensitivity? So impulse dysregulation, gambling, compulsive eating, disinhibited behavior. Now, reward sensitivity is divided into three components. This is by Gray. Behavioral activation, the get up and go, as I mentioned, the anticipatory hedonic drive. Behavioral inhibition, third component is fight and flight system. The reason why this is so important, the fight and flight system, when we're looking at procrastination, so when you think about procrastination, it's actually very similar to perseveration, isn't it? It's impaired decision making. You remember I mentioned that rigidity or lack of cognitive flexibility, I use the word cognitive constipation, it all comes down to the prefrontal cortex functioning. But there's an important part here. Remember the other side of the equation when we said the Goldilocks effect? Sometimes if the dose is too much, you may actually induce excessive cognitive rigidity as well. So this is where temporality makes a big difference, pre and post. But good question, because procrastination is usually a prefrontal cortex flexibility reducing. Dopamine plays a really big part to improve that cognitive flexibility, including noradrenaline, alpha-2A. So one of the things I want to highlight importantly as part of reward sensitivity is the fight and flight system. And this is one of the reasons why trauma and ADHD neurodevelopment plays a really important part. Often people will have this thing, well, is the arousal part of PTSD or is it part of ADHD? It's the same circuit, frontostriatal limbic. So the limbic system is activated in trauma. In fact, there are two phenotypes of PTSD. One phenotype is the emotional arousal phenotype, where the limbic system is heightened and the inhibition of the prefrontal cortex is not adequate. Exactly the same thing in ADHD. Whilst the other phenotype is the dissociative type, depersonalization, derealization, where there is excessive prefrontal cortex inhibition. So when you have patients like that, you can address it in exactly the same manner, because trauma and ADHD phenotype you will see together. We have an interactive course coming up later online on complex PTSD. You see, one of the domains amongst the 8, one of the domains is cognitive deficits. And the cognitive deficits in complex PTSD are exactly this executive function and disinhibition of the limbic system.